Question 1. The spouse of a client who sustained third-degree burns from a gasoline explosion asks the nurse, "What does third degree mean?" Which of the following is the correct explanation? A. All skin layers and underlying tissues are injured. Burns are classified by the level of damage. First-degree burns, such as a mild sunburn, are superficial. The skin is reddened and painful to the touch. Second-degree, or partial thickness burns, have blisters, the skin is pink or red, and painful. Third-degree, full thickness, burns involve all skin layers and the underlying tissues. Fourth-degree burns continue through to the muscle and bone. Question 2. A client on fluid restrictions reports 6 ounces of milk, 8 ounces of tea, and 4 ounces of sherbet. What is the client's total fluid intake? A. 18 ounces. The correct answer is 18 ounces. Liquids, milk and tea, account for 14 ounces. Since sherbet is liquid at room temperature, it is also considered a liquid. Therefore, add 4 ounces of sherbet for a total of 18 ounces. The other options are miscalculations. Question 3. A parent brings their 6-year-old son to the clinic after the child has been ill for several days. The parent tells the nurse that the child's urine has been dark brown and he has been running a fever. The nurse notes swelling around the child's eyes and in the hands. When the nurse takes the child's medical history, which of the following indicates the child has developed post-streptococcal glomerulonephritis? A. Sore throat 2 weeks ago. Post-streptococcal glomerulonephritis, PSGN, is a disease of the kidneys that occurs after infection with certain strains of a bacterium called Group A Streptococcus, gas, the cause of tonsillitis, pharyngitis, and scarlet fever. Approximately half of people affected by PSGN show no signs of the illness. When symptoms do occur, it is usually 7 to 10 days after the infection begins. The most common symptom of PSGN is swelling around the eyes. This swelling can also affect other parts of the body, such as the hands and feet. Dark, rusty, or cola-colored urine is a possible early sign of the condition. Children ages 2 to 12 are most at risk of developing PSGN. Group A strep infection is most likely at ages 6 to 7. PSGN usually resolves itself after a few weeks or months. Treatment is directed at controlling symptoms with medication and eliminating any remaining infection with antibiotics such as penicillin. A low-sodium diet may be recommended to control swelling. Question 4. EMS transports a client with complaints of chest pain and dyspnea to the emergency department. She is receiving O2 via nasal cannula at 2 liters per minute. As the nurse assesses the client, which finding would demand immediate nursing action? A. Restlessness and anxiety. Restlessness and anxiety require immediate nursing action because they indicate very low oxygenation of body tissues and are often the first indications of impending cardiac or respiratory arrest. Complaints of nausea or indigestion may accompany myocardial infarction, but they don't indicate a need for immediate action. A history of hypertension doesn't require immediate intervention. Pain on urination is not related to a myocardial infarction. Question 5. A client in the ICU has a Swan-Ganz catheter in place. When the nurse assesses the client's hemodynamics, which of the following values is abnormal? B. Cardiac output 3 liters per minute. A Swan-Ganz catheter, pulmonary artery catheter, is placed into the right side of the heart and the arteries leading to the lungs. It is done to monitor the heart's function and blood flow and pressures in the pulmonary artery. Cardiac output is the amount of blood that the heart is able to pump in 1 minute. This client has a low cardiac output. The problem is that the heart isn't pumping out enough blood, low stroke volume, resulting in heart failure. Normal values are as follows. Cardiac output, 4 to 8 liters per minute, central venous pressure, CVP 2 to 6 mm of mercury, pulmonary capillary wedge pressure, 4 to 12 mm of mercury. The pulse pressure is the difference between systolic and diastolic blood pressures. The normal range is 40 to 60 mm of mercury. It is not a Swan-Ganz measurement. Question 6. The nurse on a medical unit is caring for a client with a diagnosis of SARS-CoV-2, COVID-19. Which of the following findings requires immediate intervention? C. Pulse oximeter, SpO2, of 92%. COVID-19 clients can develop silent hypoxia, with SpO2 values of until T, 94%, even when appearing comfortable and in no distress. Low SpO2 can indicate COVID-19 pneumonia and the need for supplemental O2 or a ventilator. SARS-CoV-2 and NBSB winking sad smiley severe acute respiratory syndrome coronavirus 2 can cause a wide range of symptoms: fever, chills, cough, muscle body aches, headache, sore throat, congestion, nausea, vomiting, loss of taste, smell, or diarrhea. Emergency intervention is necessary for dyspnea, persistent chest pain or pressure, inability to wake or remain alert, cyanosis of lips or face, new onset of confusion. The CDC considers a fever to be an GT, 100.4 degree F, 38 degrees Celsius, which is managed by nursing interventions and medications. Pulse oximetry should be monitored for SpO2 and GT, 94%, less than 94% can indicate hypoxia and the need for immediate intervention. Question 7. The nurse is performing a dressing change on a below-the-knee amputation, BKA, for a client who had the surgery 2 days prior. All of the following actions are appropriate during the process except B. Lower the stump during the dressing change. Wrap the stump when it is elevated to prevent edema and blood pooling. After inspecting and cleaning the wound, first place a non-stick dressing on the wound. Then follow with a gauze or ABD pad, per policy or surgeon preference. Wrap lightly with gauze or elastic roll to hold the dressing in place. Tape onto the dressing, never the skin. Question 8. After a provider diagnoses a client with choledocholithiasis, the client asks the nurse, "I know I have stones, but where are they?" The nurse explains to the client that the stones are located in the B. Common bile duct. Choledocholithiasis is the term for the presence of stones in the common bile duct. The medical term for an NBSB, salivary stones, is sialoliths. Cholelithiasis is the term for the presence of stones in the gallbladder. Nephrolithiasis refers to kidney stones, renal calculi. Question 9. A client who just returned from a lake vacation calls the clinic with complaint of an earache. The nurse tells the client to come in right away. On inspection of the client's ear, the nurse observes that the ear canal is red, swollen, and painful. Which other clinical finding best indicates an infection in the external ear, otitis externa? C. Foul-smelling pus. Otitis externa, also called swimmer's ear, is an infection of the outer ear canal. The cause is most often water that remains in the ear, creating a warm, moist environment for bacteria. Prompt attention is necessary to prevent complications or progression of the infection. Other symptoms include warmth, itching, and clear fluid drainage. Hearing may be impacted by the swelling, but there could also be other causes. Tinnitus and vertigo are clinical indications of an inner ear infection. Question 10. A patient is admitted to the emergency department after sustaining abdominal injuries and a broken femur from a motor vehicle accident. The patient is pale and diaphoretic and is not talking coherently. Vital signs upon admission are temperature 98.0 degrees Fahrenheit 36.3 degrees Celsius, heart rate 130 beats minute, respiratory rate 34 breaths minute, blood pressure 50/40 millimeter of mercury. The healthcare provider suspects which type of shock? A. Hypovolemic. Trauma patients can experience blood loss without open wounds. A history of abdominal injury points to hypovolemic shock secondary to hemorrhage. Also, a broken femur can result in 1 to 2 liters of blood loss. As remaining blood is shunted to vital organs, the patient will become pale and diaphoretic. Confusion indicates lack of oxygen to the brain. Question 11. The nurse at an outpatient surgery center is giving post-op instructions to a 42-year-old male who has had a vasectomy. Which of the following should the nurse include? C. You will need to use another birth control method for a while. A vasectomy offers no protection from sexually transmitted infections. The client should be instructed to support his scrotum with a bandage and tight-fitting underwear for at least 48 hours after the vasectomy. Sexual activity should be avoided for about 1 week. Sperm can remain present until the client has ejaculated about 20 times, so an alternative birth control method should be used until the sperm count is 0. The client should be made aware that vasectomy is permanent, reversals are complicated and expensive and have unreliable outcomes. Question 12. A male client with a diagnosis of emphysema is on O2 nasal cannula at 2 liters per minute. While assisting him to the bathroom, the nurse observes that the client develops shortness of breath. When he returns to bed, what is the nurse's best action? A. Encourage him to use pursed lip breathing. Pursed lip breathing helps keep pressure in the airways and prevents large airways from collapsing. It also allows more air to escape. Increasing O2 in a client with COPD can eliminate the hypoxic drive to breathe. A supine position will increase dyspnea. Breathing into a paper bag is for hyperventilation, not shortness of breath. Do not recommend this technique to cardiac clients, COPD clients, or clients with asthma. Question 13. A client is admitted to the unit with ascites secondary to a diagnosis of cirrhosis. The nurse knows that the cause of cirrhotic ascites is B. Decreased albumin production. Albumin, produced only in the liver, is the major plasma protein that circulates in the bloodstream. Albumin is essential for maintaining the oncotic pressure in the vascular system. A decrease in oncotic pressure caused by a low albumin level allows fluid to leak out from the interstitial spaces into the peritoneal cavity, producing ascites. Renal function is not related to ascites. Portal hypertension causes varices, not ascites. Electrolyte imbalance can be a result of the ascites, not the cause. Question 14. The nurse is reviewing lab results for an 11-month-old girl who is scheduled for surgery to correct tetralogy of Fallot. Which lab result should be reported to the surgeon for further assessment? A. Hematocrit, HCT, 63%. Normal hematocrit, HCT, for an infant is 28 to 42%. A higher HCT indicates polycythemia, a common complication of a cyanotic heart disease, including tetralogy of Fallot. Normal WBC count for an infant is 6,000 to 17,500 WBC millimeter cubed. Normal ABG POW2 is 80 to 100 mm of mercury. Normal bleeding time for an infant is 2 to 7 minutes. Question 15. The wound care nurse is performing a dressing change for a client with a stasis ulcer. As the nurse observes that the wound appears smaller, which of the following also indicates that healing is taking place? A. The area in the wound cavity is pink. Granulation, pink, tissue is an important component in the wound healing process. Ulcers are open skin sores. They can affect any area of the skin, but they most often occur on the legs above the ankle. Stasis ulcers, also called venous ulcers, are leg ulcers caused when the valves in the veins do not return blood to the heart. Chronic venous insufficiency causes a buildup of pressure and blood pools in the lower legs, resulting in edema. The swelling causes fluid to leak into the skin and tissue to form an ulcer. All of the other options are signs that the wound is infected and not healing. Question 16. When the nurse enters a client's room, the client tells the nurse that after sitting for a long time, she feels lightheaded when she tries to stand. What is the most appropriate way for the nurse to assess the client? C. Take the client's blood pressures when lying, sitting, and standing. The nurse should assess for orthostatic hypertension by taking the client's blood pressure when she is lying, sitting, and standing. Orthostatic hypertension occurs with a drop of 20 mm of mercury in systolic blood pressure or a drop of 10 mm of mercury in diastolic blood pressure within 2 to 5 minutes of standing up, or if standing causes signs and symptoms such as feeling lightheaded or dizzy. Question 17. Following a client's lung resection, the hourly output from the chest tube is 300 milliliters. The first priority should be to A. Notify the physician of the output. The output of 300 milliliters is indicative of hemorrhage and should be reported immediately. Be prepared to report recent hourly outputs and descriptions of the outputs. Turning does nothing to help the patient. Milking the tube should only be done on a doctor's order. Slowing the intravenous infusion is not appropriate. Question 18. A 32-year-old client with a diagnosis of type 1 diabetes calls the clinic to report that they have gastroenteritis. To prevent dehydration during the illness, which of the following should the nurse advise the client to do? C. Drink 8 to 10 ounces of various fluids every hour while awake. Dehydration must be avoided in a client with diabetes because of the risk of developing diabetic ketoacidosis, DKA. The nurse should encourage the client to drink 8 to 10 ounces of fluids containing both glucose and electrolytes at least every hour, returning to a normal diet as soon as possible. Withholding fluids, drinking only water, and remaining on clear liquids all can be dangerous for a client with type 1 diabetes. The client should also be instructed to monitor blood glucose levels and report any abnormal readings to the provider. Question 19. A previously healthy 60-year-old female is transported by EMS for a complaint of chest pain. EMS places her on an O2 cannula at 2 liters per minute. On arrival at the emergency department, which nursing action is most important to address? C. Restlessness and feelings of apprehension. Restlessness and expression of apprehension demonstrate lack of oxygenation and indicate impending cardiac arrest. Nausea and indigestion may be part of angina or myocardial infarction but are not emergent. Fatigue can contribute to the inability to focus. Assessment of history is not a nursing priority at this time. Question 20. The nurse is instructing a client who is being discharged with a Jackson-Pratt JP drain. When teaching the client to care for the JP drain at home, which of the following should the nurse tell the client? A. Milking the tubing will help move clots to the bulb. A Jackson-Pratt JP drain has a soft plastic bulb with a stopper and a flexible tube attached to it. The bulb remains compressed at all times except when being emptied. It should be emptied when it is half full, or every 8 to 12 hours. The client should record the amount of drainage each time the drain is emptied. Showering daily is permitted. While showering, the client should secure the bulb to keep it from pulling on the skin or becoming dislodged. The client should be taught to milk the tubing to move clots. Question 21. A nurse enters a client's room to change the person's dressing. The nurse notes that the client is unresponsive and not breathing. After calling for help, what is the nurse's next action? B. Check for a carotid pulse. According to the American Heart Association's Basic Life Support, the first step after determining a victim is unresponsive is to call for help. The next step is to check for a pulse, for no more than 10 seconds. If there is no pulse, the rescuer should begin CPR, 30 chest compressions followed by 2 ventilations. If the client has a pulse, maintain an open airway and provide ventilations. Question 22. The emergency department nurse is caring for a client having an acute asthma attack. At the first assessment, the nurse heard low-pitched wheezes during the second half of exhalation. During the second assessment, 1 hour later, the nurse notes that the wheezes are higher in pitch, lasting for the entire exhalation. What does this change between assessments indicate? B. The client's airways are narrowing. The change to a higher-pitched wheeze that lasts longer indicates the airway obstruction has increased or worsened. Urgent intervention to promote bronchodilation or a change in current interventions is necessary. Other signs of worsening asthma and the development of respiratory distress include restlessness, anxiety, tachycardia, increased blood pressure, and increased respiratory rate with the use of accessory muscles of respiration. Although secretions may be thick and tenacious during an acute asthma attack, there is no data here to support the need for suctioning. There is no data to support intubation or that the client is hyperventilating. Question 23. Parents bring their 9-month-old infant to the emergency department, reporting that their baby has been irritable and lethargic for 2 days. The nurse observes poor skin turgor and tachycardia. To obtain more information, what is the best question that the nurse should ask the parents? B. How many wet diapers has your baby had in the last 24 hours? The infant is showing clinical manifestations of dehydration. Asking about the number of wet diapers is a way of estimating output. Normal output for an infant is 1 milliliter per kilogram per hour. Other signs of dehydration in infants are dry mucous membranes, increased thirst, dark-colored urine, high specific gravity, sunken eyes, lack of tears when crying, and depressed fontanelles. The other questions are appropriate but not related to assessing the baby's intake and output. Question 24. A patient with pancreatic cancer has undergone a Whipple procedure. During the Whipple procedure, the surgeon removed the A. Pancreas, head and gallbladder. During a Whipple procedure, the head of the pancreas, most of the duodenum, the gallbladder, a portion of the common bile duct, and lymph nodes are removed. In some cases, the entire duodenum and a portion of the stomach, pylorus, may also be removed. The Whipple procedure is a major and risky surgery. The 5-year survival rate is 20 to 25%. Question 25. A client with a diagnosis of end-stage renal disease, ESRD, is beginning peritoneal dialysis. The nurse instructs the client to warm the dialysate before infusing it. Which of the following is not a reason to warm the solution? A. The chance of peritoneal infection is decreased. Sterile technique, not the temperature of the dialysate, prevents infection when performing peritoneal dialysis. The other choices are correct. Warm solution promotes vasodilation in the abdomen, which allows the toxins to be removed. Also, warm solution is more comfortable for the client than cool solution. Question 26. A client comes to the clinic with complaints of heart palpitations, shortness of breath, fatigue, and syncope. An ECG indicates atrial fibrillation. When the nurse performs an assessment, which finding is most concerning? C. Difficulty speaking. Difficulty speaking is indicative of a stroke. During atrial fibrillation, AF, the atria beat chaotically and irregularly out of coordination with the ventricles. Atrial fibrillation symptoms often include heart palpitations, shortness of breath, chest pain, fatigue, weakness, lightheadedness, fainting, and intolerance of exercise. The heart rate in AF can range from 100 to 175 bpm, sometimes higher, reducing cardiac output by 10 to 30%. AF causes a higher risk of stroke due to the inability of the atria to contract. This leads to blood collecting in the atria and clot formation. Anticoagulant therapy is a priority in managing AF. Type 2 diabetes is a risk factor for developing AF, but is not the greatest concern at this time. Unplanned weight loss should be investigated, but is not the priority at this time. Question 27. Which of the following is a sign of an asthma attack? A. Expiratory wheezing. An asthma attack is a sudden worsening of asthma symptoms, caused by the tightening of muscles around the airways, resulting in bronchospasm. During the asthma attack, the lining of the airways also becomes swollen or inflamed, and thicker mucus, more than normal, is produced. Wheezing occurs during expiration because of impaired air movement from constricted edematous bronchial lamina. Respirations may be difficult, but the rate is typically normal or rapid. Question 28. An emergency department nurse is sent to the scene of a school bus versus train accident to perform triage. Which of these 4 victims should be transported and treated first? C. 16-year-old female with tachypnea, hypertension, and a rigid abdomen. In a mass casualty event, triage has 5 categories, identified by colored tags. Red, immediate, can survive with immediate treatment. The 16-year-old female has signs of internal bleeding and hypovolemic shock. Yellow, observation in stable condition, but requires treatment. Ordinarily, these persons would be seen right away. This is the 8-year-old with the tibial fracture. Green, wait, the walking wounded who will need medical care at some point, but are not in immediate danger. This is the 12-year-old with lacerations. White, dismiss those with minor injuries for whom a doctor's care is not required. Black, expectant the deceased and those whose injuries are so extensive that they will not be able to survive with the care available. This is the 14-year-old who is already near death. Question 29. The nurse is providing education for a client scheduled for an upper gastrointestinal (GI) series. Which statement by the client best indicates that the client understands the procedure? B. Swallowing barium helps the radiologist see. An upper GI series is a diagnostic procedure using an NBSB, X-rays, and NBSB, fluoroscopy, and a chalky liquid called an NBSB, barium and NBSB, to view the esophagus, stomach, and duodenum. Findings can include cancer, esophageal varices, GERD, hiatal hernia, ulcers, and strictures. The procedure is performed without anesthesia. The client is NPO for at least 8 hours, then asked to stand or sit in front of an X-ray machine and drink barium, which coats the lining of the upper GI tract. The client then lies down and the radiologist observes, with fluoroscopy, the barium as it advances. The client may be asked to change positions during the test. Following the study, the client can resume normal activities and diet. Question 30. A 65-year-old male client presents to the emergency department with complaints of constant pain in the back and umbilicus area. Diagnostic testing reveals the client has an abdominal aortic aneurysm, AAA. The client asks the nurse, "What is an abdominal aortic aneurysm?" Which of the following is the correct response by the nurse? A. An AAA occurs when part of the wall of the abdominal artery bulges outward. An abdominal aortic aneurysm, AAA, is an enlargement or ballooning of a section of the abdominal aorta. An AAA can develop slowly, often with no symptoms. Some aneurysms never enlarge or require surgical repair. Symptoms occur if it expands rapidly, suddenly rips open or leaks blood into the aortic wall, aortic dissection. This is a medical emergency, requiring immediate surgery to prevent massive internal hemorrhaging. Risk factors are being male, age over 60, smoking, hypertension, and family history. The other options are incorrect. Question 31. The healthcare provider is evaluating the effectiveness of discharge teaching of a male patient following an abdominal aortic aneurysm, AAA, repair. Which of these statements, if made by the patient, would indicate the teaching has been successful? C. It's possible that I may experience some sexual dysfunction. Male patients often experience erectile dysfunction after AAA repair, caused by decreased blood flow to the pelvic area during surgery. Also, the expanding abdominal aorta can compress and damage the nerves and blood vessels of the penis. Patients are taught to palpate pulses below the level of the repair, not at the radial artery. The strength and quality of the pulse is more important than the rate. Exercise is slowly increased. The surgeon will advise the patient about activity. Avoiding communicable infections can be discussed, but it is not the priority of discharge teaching. Question 32. The nurse in a medical unit is caring for a client who was admitted a day ago for a fall at home. Which assessment finding is the immediate priority? A. Large bruise behind one ear. The most urgent finding is the bruising behind an ear, over the mastoid process. This is called Battle's sign and is an indication of a skull fracture. It appears 1 to 2 days after the event. Other clinical manifestations of a skull fracture include bleeding from the ear, nose, or eyes, clear fluid leaking from the ears or nose, confusion, irritability, or drowsiness, change in speech, difficulty swallowing, loss of balance, changes in pupils, and headaches. The other options require attention, but are not the immediate priority. Question 33. The nurse is at home with their 10-year-old son when the child falls off his bike and his front tooth is avulsed, knocked out. The nurse is able to quickly retrieve the tooth. What is the nurse's best action before going to the emergency department? C. Place the tooth in milk for transport to the ED. An avulsed tooth is totally dislodged from its socket. It is medical dental emergency that requires prompt treatment to minimize hypoxia and necrosis of the pulp of the tooth. Reinsertion should be done within a few hours. Do not touch or handle the root of the tooth. Rinse the tooth with saline and pack the socket with sterile gauze. The preferred storage solution is milk, with saline or saliva if milk is not available. Holding the tooth in the cheek helps keep it moist, but there is a risk of the child swallowing it, so this is not an ideal solution. Question 34. The nurse is camping with friends when one of the campers trips and falls into a campfire. The friend is quickly rescued, but has sustained burns on their face, neck, and chest. When the nurse provides emergency care, what is the priority? C. Preserve the airway. With burns on the face, neck, and chest, this person is especially at risk for having a compromised airway and difficulty breathing. The nurse should first evaluate for airway and breathing. If the person can sit up, it will reduce edema in the face and neck, helping to maintain the airway. Emergency burn treatment follows an APDEF process: A equals airway, B equals breathing, C equals circulation, D equals disability, other injuries, E equals expose, remove clothing, F equals fluid resuscitation. Removing clothing should be done, but is not the first action. Cool compresses are not appropriate. The burn area will be calculated later. Question 35. After an unremarkable labor and delivery of a healthy baby girl, the new mother is resting. The nurse measures the mother's heart rate and observes which to be typical. A. Bradycardia. Puerperal bradycardia, 50 to 70 bpm, is typical for 6 to 10 days postpartum. It may be related to decreased cardiac strain, decreased blood volume, contraction of the uterus, and increased stroke volume. The other options are atypical and should be assessed. Question 36. Soon after admission, a patient displays signs of possible pulmonary edema. Which position is most appropriate for this patient? A. Fowler's. Fowler's, specifically, high Fowler's at 90 degrees, will decrease venous return to the heart and increase lung expansion. Sims position places the patient on their left side and is used for rectal examinations. In Trendelenburg position, the patient is supine with the head lowered, which would overload the lungs. Orthopneic position is used when a patient cannot tolerate lying down, but it decreases lung expansion. Question 37. A 17-year-old comes to the OB/GYN clinic because she is worried she might be pregnant. After an initial discussion and assessment, the nurse measures the client's fundus and finds it at the level of the umbilicus. The nurse tells the client, C. You're about 20 weeks pregnant. At 20 weeks gestation, the fundus is at the level of the umbilicus. At 10 weeks, it is at or slightly above the symphysis pubis, about where pubic hair begins. At 30 weeks, the fundus is about 10 centimeters above the umbilicus. After 20 weeks, the fundus height correlates with the number of weeks of gestation. This client is about 5 months pregnant. Question 38. A 30-year-old patient with a congenital atrial septal defect has lived with the defect without significant problems until now. Which of the following is an indication that the patient is becoming hemodynamically symptomatic? C. Exertional dyspnea. Because blood is shunted from left to right, Pulmonary blood flow is increased. Pulmonary arteries become enlarged. Increased pulmonary pressure can result in pulmonary edema, which interferes with gas exchange, especially when the patient is active. Bronchoconstrictor and wheezing are caused by constriction of bronchial smooth muscle and are not hemodynamic symptoms. Intermittent claudication occurs when there is decreased arterial blood to skeletal muscle. Question 39. A mother takes her 2-month-old child to the urgent care clinic. She reports that shortly after the child developed a fever, his voice became muffled and he began drooling. Inspiratory stridor is present. The priority action of the healthcare provider is to C. Call for immediate assistance. This child has the signs of epiglottitis, a life-threatening emergency. It's caused by a bacterial infection that causes the epiglottis, the flap at the base of the tongue, to swell quickly. Without immediate treatment, it can completely close off the airway. The nurse will need assistance to secure the child's airway. In this instance, inspection of the throat should not be attempted because it may trigger a laryngospasm. Asking about allergies is routine and important, but it's not the first priority. Question 40. The healthcare provider is assessing a patient admitted with a diagnosis of hemorrhagic stroke affecting the right cranial hemisphere. Which assessment finding is consistent with this diagnosis? C. Left-sided flaccidity. A patient who has sustained damage to the right cranial hemisphere will experience loss of motor function on the left side of the body. Koenig's sign is an indication of meningeal irritation and is not an expected finding. Spasticity is muscle tightness and loss of control over the muscles. Flaccidity is low muscle tone. Flaccid paralysis, a complete lack of voluntary movement, often occurs immediately after the stroke. Question 41. Following a femoral popliteal bypass graft procedure on the left leg, the client returns to the unit. The nurse provides routine post-op care including monitoring pedal pulses distal to the graft. After 5 hours, the nurse is unable to palpate a pulse or locate it by Doppler. The nurse also notes that the client's foot is pale and cool. What is the nurse's best action? D. Notify the provider immediately. A femoral popliteal bypass graft procedure is performed to improve blood flow that has become restricted by excessive plaque buildup, atherosclerosis. Postoperative assessment includes monitoring circulation, noting the rate, rhythm, and quality of peripheral pulses distal to the graft, color, temperature, and sensation. Lack of pulses indicates a lack of circulation distal to the graft, which is an emergency. The nurse should notify the provider immediately. Question 42. At a client's routine prenatal visit, which of the following changes in blood pressure from the previous visit is most concerning? D. Previous 118/70 to current 130/88. Most of these blood pressure readings are abnormal. The point of this question is to assess which systolic and diastolic readings have changed the most for this individual client. A jump from 118 to 130, an increase of 12 mm of mercury, for the systolic reading, and from 70 to 88 mm of mercury, an increase of 18 mm of mercury, for the diastolic reading is more significant than the others? Question 43. The healthcare provider is caring for a patient with an implanted permanent pacemaker because of complete heart block and severe bradycardia. Which of the following should the healthcare provider assess first to determine pacemaker functioning? D. Electrocardiogram, EKG. An apical pulse within the normal range will give some indication that the pacemaker is functioning, but it will not specifically show how often the pacemaker is firing. An EKG is the best way to determine pacemaker function because the actual pacing is determined by pacer artifact, which can be seen on the EKG strip. Question 44. The nurse receives a client in the coronary care unit, CCU, after a coronary artery bypass graft, CABG. At the end of the first hour, the client's mediastinal chest drainage was 90 milliliters. At the end of the second hour, the drainage was 15 milliliters. Which of the following is the most likely reason for the drop? D. The drainage tube might be occluded. As standard postoperative practice following cardiac surgery, mediastinal chest and NBSB drains, including pericardial drains, are inserted to assist the clearance of blood from the pericardial space and prevent cardiac tamponade. The CCU nurse records hourly output from all drains, including the mediastinal chest drain. Normal mediastinal chest drainage should not exceed 100 to 150 milliliters for the first 2 post-op hours. A sudden drop in the postoperative period indicates possible occlusion. The nurse should assess the situation and respond according to hospital policy. Question 45. A client with a recent diagnosis of Hodgkin lymphoma is admitted to the unit. When the nurse palpates the client's cervical lymph nodes, what is the most likely finding? D. Lymph nodes are enlarged, movable, and painless. Swollen lymph nodes from Hodgkin lymphoma are often painless, movable, and have a soft, rubbery feel to them. Hodgkin lymphoma, formerly called Hodgkin's disease, is a cancer affecting the lymphatic system, part of the body's germ-fighting immune system. In Hodgkin lymphoma, white blood, lymphocytes, grow out of control, causing swollen lymph nodes and growths throughout the body. The most common symptom of Hodgkin lymphoma is one or more enlarged, swollen, lymph nodes. The enlarged lymph node may be in the neck, upper chest, armpit, abdomen or groin. The swollen lymph node is usually painless. Diagnosis is made by a lymph node biopsy. Question 46. A parent takes their 6-year-old child to the emergency department at 0200. The child's signs and symptoms are as follows: temperature 103.4 degrees Fahrenheit, difficulty swallowing, absence of spontaneous cough, stridor on inhalation, drooling, and restlessness. The parent says, "This all happened so quickly." These clinical manifestations indicate which of the following acute conditions. D. Epiglottitis. Acute epiglottitis is a potentially life-threatening inflammation of the epiglottis, blocking the flow of air into the trachea. Symptoms in children include fever, severe sore throat, absence of spontaneous cough, difficult and painful swallowing, drooling, anxiousness, restless behavior, and stridor on inhalation. Onset is within hours. Tracheitis is an infection of the trachea, usually following an upper respiratory infection, URI, such as a common cold. Initial symptoms include cough, runny nose, and low-grade fever. Spasmodic croup comes on suddenly, often in the middle of the night. Symptoms include gasping for air, stridor, a barking cough, and hoarseness. Fever is uncommon. Laryngotracheobronchitis is the same thing as croup. Question 47. EMS transports a patient with a gunshot wound to the head. The patient is unresponsive and displaying decorticate posturing. Which area of the brain has been damaged? D. Midbrain. Decorticate posture is a sign of damage to the nerve pathway in the midbrain, which is between the brain and spinal cord. The midbrain controls motor movement. Damage to the rostrum brainstem causes decerebrate posturing, which is more severe than decorticate. Flaccid posturing results from injury to the medulla. The amygdala is the area of the brain that processes fear. Question 48. A 22-year-old female with a history of type 1 diabetes is brought to the emergency department. Which respiratory pattern would indicate diabetic ketoacidosis, DKA? D. Deep, rapid respiration rate with long expirations. Deep, rapid respirations with long expirations, known as Kussmaul respiration, indicate metabolic acidosis. As the body attempts to get rid of carbon dioxide and acetone, breathing increases in depth and rate. The breath has a fruity scent. Other signs of DKA are excessive thirst, nausea, vomiting, abdominal pain, weakness, and confusion. DKA can be life-threatening and requires rapid treatment. Question 49. A 52-year-old female client presents to the clinic with symptoms of abdominal swelling accompanied by weight loss. She tells the nurse that when she eats, she feels full quickly. Also, sex has become painful. The nurse recognizes these symptoms as clinical indications of D. Ovarian cancer. Often, ovarian cancer has either no symptoms or vague symptoms such as weight loss, bloating, difficulty eating, painful sex, urinary urgency, and constipation. Then the cancer goes undetected until it has spread within the abdomen and pelvis. Only when a combination of symptoms appear, and are persistent and represent a change from normal, can healthcare providers consider the possibility of ovarian cancer. Question 50. Following a motor vehicle accident, EMS transports a client to the emergency department. The client is conscious and breathing, but injuries are unknown. Which is the best position for this client while waiting for rapid evaluation? D. Supine, with neck immobilizer in place. Following any accident with unknown injuries, treat the client as if there is a spinal cord injury. Use a neck immobilizer or cervical collar to prevent any movement of the upper spine. Raising the head promotes blood flow and can decrease intracranial pressure, but first the cervical spine must be evaluated. Fetal position, lateral, with flexed knees and neck, is incorrect. Prone position is incorrect.